Of their children were viciously and arbitrarily stripped from their mothers by the authorities. That, at least, is one way of looking at their stories. The other way to look at the story is that the three women who sit before you today actually all suffer from a bizarre psychological condition in which these ladies make up or even cause the illnesses in their children in order to get attention and sympathy for themselves. Mother love or smother love? Okay, that's our focus. Let me introduce quickly Dr. Alfred Fireman, a psychiatrist who testified in favor of Ellen at her trial. He's the gentleman on your left. He believes that Munchausen is a lot rarer than some people say. John Chiarelli, sitting to his right, Ellen's attorney, currently appealing the ruling that took Aaron away from her. Dr. Fireman, is she or is she not a sufferer of Munchausen?
She is not.
Do you think the state has made a grievous error here, acting arbitrarily and capriciously?
Yes, I believe they have. Not arbitrarily and capriciously, but without the testimony of a psychiatrist who would be the correct person to make such a diagnosis if it is a psychiatric condition.
Why are you shaking your head, Dr. Alexander?
It's a pediatric diagnosis. It's not a mental illness as such. In fact, you can sit in a room with somebody, give them tests all day long. You'll never make a diagnosis of Munchausen syndrome by proxy. It's a behavior.
Okay, what's the motive of the state, Doc?
I have to tell you that he's in error. As a pediatrician, he takes care of children, and he knows that far better than I could ever dream of knowing it. Munchausen's disease by proxy is alleged to be a disease of adults. But the reason I say alleged to be a disease of adults is because even in the latest edition of the psychiatric nomenclature, there is no subcategory of a condition called Munchausen's disease by proxy. The pediatricians and the psychologists have identified the mothers of some of these children as having a behavioral abnormality that they have defined as Munchausen's disease by proxy.
Do you agree that Ellen has a behavioral abnormality?
I believe she's a hyperzealous, overly involved mother who has followed the directives of first-class pediatricians and pulmonologists who've examined her child.
Is she a hypochondriac by proxy?
She is. I'll tell you what, if we had to fix a formal formula of diagnosis, if we had to give a term that could be worked with and treated, that would be a fair statement. But for hypochondriasis in one's own condition, are we otherwise punished in the community?
But John, we have an overburdened child protective system from one coast to the other in this country. What would be the motive of stripping this mother of four of one of her four children if it was not a problem?
I think the problem is that it's a sexy diagnosis. It's something new and groundbreaking. I think they reacted to that. They couldn't resist it. I think also the problem is that they rushed to the elements of a so-called profile that have been established by the psychiatrists in this field as they've studied children who have been affected by real cases of allegedly called Munchausen, and they found elements of the profile that occur. We all fit some sort of profile.
Arza, are they trying to make Ellen into some sexy case of some rare disease when in fact she is just a hypochondriac, an overzealous mom?
No. I believe that, well, we had two independent experts review the entire medical history of this family. And one of them was right in New York out of Columbia Presbyterian. He not only reviewed the entire family medical history, he spoke to the children, he spoke to the mother, he spoke to the foster mother.
But why is she doing it? Why is she doing it?
Well, as Dr. Alexander explained, this is a behavioral pattern that some mothers engage in order to get the attention and the support of a society.
Let me get some questions from the audience. Yes. Quickly to Dr. Randall Alexander, professor of pediatrics at the University of Iowa. He's treated nearly 30 cases of this relatively rare condition. Doctor, do you think you can quickly whip off 3 examples of this syndrome so people really get a grasp of what's going on?
Well, it shows up in lots of different ways. For instance, one case that I can think of is a mom who fed her child X-Lax. We thought the child had chronic diarrhea, and actually went so far as to put lines in plastic catheters into the child's body, trying to keep nutrition going that way. And it was only later that we tumbled that maybe something was being tinkered with and found X-Lax in the stool. Other examples can be things like a mother who was calling up 911 at 4:30 every Tuesday, it was every third Tuesday, and saying that her child had some sort of a spell where it quit breathing or something. And they'd get there and the mother would be doing CPR on the child. And they put the child in foster care and it all went away. Never happened before. Checking back, found out that the mother had Munchausen syndrome herself, and that she'd previously had a child with Munchausen syndrome by proxy, and the child had actually died. So there are a number of ways in which this thing can show up.
The facts as alleged in this case, if true, would Ellen be a Munchausen by proxy person?
They would. The key features would be the extreme number of episodes that are alleged and the fact that they completely disappear in foster care, along with the fact that we're, again, trying to find some medical condition that really doesn't make a lot of sense.
Ellen,
is this the same syndrome that I read about where parents will actually over-medicate a child or give them medication for diseases and problems that they don't really have, and in essence maintain control over the child through that?
Dr. Alexander?
Absolutely. A lot of times there's the giving of medicines or even deliberate poisoning. We exclude the kind of poisoning that's just meant to kill somebody and isn't really trying to present somebody to the hospital and fool someone. But certainly when a child has funny things going on, one of the things that's sometimes done is to actually check and see whether somebody's slipping something to them.
Mm-hmm. And again, the reason for this condition is just to bring attention to yourself. A mother would threaten the life or even take the life of her own child just for attention?
Sounds kind of cruel, doesn't it? And it is one of the most premeditated forms of child abuse. There's different kinds of attention that they get. As an example, one mother we found eventually was claiming that her child had near-miss SIDS episodes or some sort of apnea episodes. And we found that every time her husband went out of town, she'd show up in the emergency room.
Whenever her husband was home, it never happened.
That's right.
So, mother love or smother love, it's an investigation. There are two sides to this story at least. Dr. Fireman.
Geraldo, to say that Ellen Stork has Munchausen's disease by proxy is to say that my cold is fulminating tuberculosis. They both happen to be upper respiratory difficulties that some of us have in the most exaggerated and severe conditions that require inordinately complicated treatment programs, and some are at the lowest end of the scale. The difference between an inducer of physical illness in a child, a fabricator of physical illness in a child, a simulator of physical illness in a child, or an anxious, frightened mother following the directives of a pediatrician, that spectrum is so vast. To simply treat every one of these ladies as if somehow they all have the same condition, and the first maneuver is to take away the child. At least there ought to be some rational alternative. Maybe work with the mother, maybe get into the family.
But even if the life is at stake?
The life is not at stake. That is that is part of the mythology of saying that because some people who have Munchausen syndrome actually put the life of their child in jeopardy, everyone expected of having anything resembling Munchausen's disease should now have their child taken away. Listen to this paradox.
Hurry.
Guilty by reason of insanity. Even not guilty by reason of insanity people get a better approach by the courts and by the disposition system.
Then
the sentence of these ladies were sentenced to the death of their children almost in terms of the absence for allegations of a condition of illness.
Okay, the other side gets to say something when we come back. Stay tuned. Dr. Alexander, you want to give us a capper?
Well, I think that in these cases, it's clear that the mothers enlist a doctor. If you can't sucker a doctor into this, you've got a problem. So they do have legitimate diagnoses, and they'll have many, many hospitalizations in many cases. This is a very serious form of child abuse. It certainly exists. When doctors are being fooled because someone wants to exploit the life and health of their child, that's a big problem for us.
Mother love or smother love?